Time now for Health Watch. The White House is responding to reports of President Trump pulling back from a ban on most flavored e-cigarette products. You'll recall back in September, the president said he was moving forward with the ban in an effort to curb the teen vaping crisis.
Well, now, according to multiple reports, Mr. Trump is holding off on the ban over concern that he could lose support from voters. White House Deputy Press Secretary Judd Deere tells CBS News President Trump is committed to responsibly protecting the health of children and that the rulemaking process is ongoing. And this all comes as the Centers for Disease Control and Prevention says that it has identified a chemical of concern in the deadly vaping outbreak.
CDC officials now say vitamin E acetate, an additive sometimes used in e-cigarette products, may be linked to the national outbreak that sickened thousands and killed at least 42 people across the United States. Joining us from Atlanta to talk more about this is Dr. Ann Schuchat. She's the Principal Deputy Director for the Centers for Disease Control and Prevention. So, Doctor, explain to our viewers what is vitamin E acetate and how is it connected to the cases that we've seen across the U.S.?
Vitamin E acetate is an additive that's often used in food and can sometimes be used in creams or topical formulations, but it was never intended to be inhaled or used in the lungs. And what we're seeing is this oily substance has been included in some e-cigarette liquids or vaping product liquids. It can look a bit like THC oil, and we think that it may be being added to THC-containing fluids to thicken or essentially adulterate the oils and perhaps for profit margin on the part of the dealers. What we're seeing in our investigation is, of course, over 2,000 people now have had serious illness from this e-cigarette or vaping-associated lung injury, and we're finding vitamin E acetate in products in specimens collected from clinical samples of people who've undergone a procedure called bronchoscopy. So we, out of 29 patients in 10 different states, we found the vitamin E acetate in the fluid collected from around the lung. This is the first time this potential culprit has been found directly at the site of injury in the lungs. It's also been found in a number of products collected from patients with the disease, tested either through FDA or through state laboratories, and so it's a culprit of major concern for us. We don't know if there are other substances potentially causing lung injury in this outbreak, but we are very concerned about vitamin E acetate.
So what happens to the oil or to the vitamin E acetate when it's vaporized?
Well, the aerosol that's produced may change products, but we know that essentially inhaling oily or sticky substances is not a great idea. Our laboratory is right now doing testing of the aerosol products. Those tests aren't done yet, so we don't know all the procedures there. And there's additional tests going on of clinical specimens to look at the patterns in the lung that are found. There are theories out there of both lipoid or lipoid pneumonia, where there is a reaction to oils in the lung. There's also concern about the effect that vitamin E acetate may have on surfactant or a phospholipid that is helping the lungs stay stay blown up or expanded. But we don't have all the specifics about what this substance might do in the lungs. We just know that it shouldn't be there, and it's in 29 specimens so far from patients.
Man, I just keep thinking about the folks who struggled with smoking and decided to choose vaping as an alternative, and the stuff that they put in the whatever it is. I'm not a vapor, so whatever goes into it just sounds as horrible, and we don't really know as much about it as we do with nicotine and other cigarettes.
So, doctor, this vitamin E acetate, it's obviously not in all of the different vaping liquids, only certain ones?
Right. What we're doing right now is trying to better understand the supply situation. Let me say that the lung injury outbreak primarily has been associated with e-cigarette or vaping products that contain THC. There are some, about 10% of cases, that do not report THC use. They've only used nicotine-containing e-cigarette or vaping products. And the vitamin E acetate might be included in a variety of substances. we think that it's very difficult for someone who's using vaping products to know all the ingredients right now. And so we strongly recommend people do not use vaping products that contain THC, do not use products that are obtained on the street or basically from friends, family, or in-person dealers or online dealers. Those kinds of products right now seem to be the ones that are associated with this lung injury outbreak.
So could it possibly be that vaping products, vaping companies are getting a bad rap because young people are using the products in a way that it was not intended to be used?
Well, let me say there are two epidemics going on right now. There's an epidemic of lung injury associated with e-cigarette or vaping products primarily containing THC. There's a second epidemic right now, skyrocketing rates of teen use of e-cigarettes, the nicotine-containing e-cigarettes. We believe that more than a quarter of high school students are recent users of e-cigarettes, and many of them are frequent users. We've seen this dramatic rise over the past 3 years in the use of e-cigarettes by high school and even middle school students. And we think that part of that story is related to flavors, to youth advertising that's kind of under the radar, and then to the very high nicotine content in those substances, which can be very addictive. So there's two different outbreaks going on, both of them of major public health concern.
Really interesting. Dr. Ann Schuchat, thank you very much. We appreciate it.
My pleasure.